Hello, PsychU community, and welcome to today's webinar, The Impact of Pandemics on Wellbeing, Implications for Healthcare Systems and Providers. Rachel Self here, Senior Medical Science Liaison for Otsuka Neuroscience Medical Affairs. And I will serve as today's moderator with a discussion featuring Drs. Allan Chrisman and Gaurava Agarwal. Dr. Agarwal is one of our PsychU MDD section advisors. He's Associate Professor in the Department of Psychiatry and the Behavioral Sciences, as well as Associate Professor of the Department of Medical Education and the Director of Physician Wellbeing for Northwestern's medical groups. He's also the Director of Undergraduate Medical Student Education and Psychiatry at Northwestern Feinberg School of Medicine here in Chicago. Dr. Allan Chrisman is Associate Professor Emeritus at Duke University School of Medicine, co-chair for the North Carolina Psychiatric Association Disaster Committee, member of the American Psychiatric Association Committee on Psychiatric Dimensions and of Disasters, member of American Academy Child and Adolescent Psychiatry Disaster and Trauma Issues, as well as volunteer for American Red Cross Disaster Health Services and Disaster Mental Health Solutions. A lot of credentials there. Thank you both so much for joining us today. Today's presentation is going to be sponsored by Otsuka and Lundbeck.
Thanks, Rachel. Thank you for the kind introduction, and very excited to be here with Dr. Chrisman. Just want to start off by thanking the audience. I know everyone in the audience has been working really hard now for 9-10 months, and your efforts are greatly appreciated. Obviously the issues of the last 10 months or so have had an impact. And as we look, generally speaking, there's been increasingly good data out in terms of understanding what that impact has been. And so this is data from the CDC that is showing that about 40% of US adults are struggling with some mental health or substance use issues, with anxiety and depression symptoms at 31%, started or increasing substance use at 13%, trauma and stress-related disorder symptoms at 26%, and seriously considering suicide at 11%. Each of these categories is between 2 and 4 times as common as the comparable time period in 2019. And so there's been a clear impact that you're seeing across our nation. I think Dr. Chrisman will share with us some additional newer data and how this impacts healthcare professionals specifically.
Yes, I think we are very much at this point struck with not only the cumulative effect, but the uneven effect that this has had on the mental health of the population and of all subgroups. If you look at the latest CDC data, which has through the Pulse survey been measuring systematically indicators for anxiety or depression in the population, they break it out also according to age groups, ethnicities, and gender. And what you see is that the unevenness within the population by age group starts with the highest impact with the younger part of the population, starting with adolescents being the highest. And then as you get older, increasingly in the workforce, the figures are still pretty high. They're 58.9% for the 18 to 29-year-olds. And then they sort of slightly decreased, but they were still very high as indicated by this slide. What's striking is that the one group that seems to be relatively less effect, which I happen to fall in, is the age 70 to 79. And I suspect because our retired life is more like being sheltered in place. So in some ways we have our own sort of bubble. We prepared ourselves for it. We have more or less adequate resources if you're fortunate to deal with. It is disproportionately also affecting women. And I think we know from the employment figures recently that women are disproportionately impacted, having to take on added childcare responsibilities and the stress associated with that. And then also within the racial and ethnic population breakout, you can see that the African American population is disproportionately heavily affected, and they bear the heavy burden also in terms of the mortality rate and infection rate and unemployment within the community. So the healthcare population has been looked at as well in more recent, as in the last few days, even studies that come out of the UK, but also the US show us that over half of the healthcare workforce, the physicians and nurses, and particularly if you're in the high exposure areas with ICU work, very high rates of distress, and it varies across the type of symptoms, but there is a strong concern here that there is going to be a lasting and long-term impact. Certainly, we went into this with a high burnout rate, and now we're faced with this on top of everything else. So the idea of flattening the mental health curve has not turned out to be as we had hoped it could be. I think it may be certainly better than it could be if it were no efforts made, but we are in an era where we have to be very active and concerned about the mounting impact that it's had on the mental health. So this slide here, focusing again on sort of performance orientation for healthcare workers, shows us that there's a important sort of range within which we need to be optimally placed in order to do our jobs well. And this is called the resilient zone. And you can see here that if you're either above or below that zone, you're going to have particular kinds of evidence of distress and impairment. The lower part, of course, demonstrates the depression, isolation, exhaustion, fatigue, and numbness that people are prone to. But likewise, the other side of it is hyperactivity, hypervigilance, mania, anxiety, panic, rage, and pain. And again, these surveys looking at physicians and nurses does show that all of these symptoms are indicators of distress. But I think G is going to be able to tell us more about that.
Yeah, thanks. I mean, I think this slide is really very instructive in terms of the evolution from where we were early in the spring and where we are now. You know, I think when we think about stress and we think about our stress response, you know, our bodies are pretty well adapted towards acute stressors, and we have a dedicated response to acute stressors, as Dr. Chrisman talked about in terms of this arousal response. That changes when we talk about chronic cumulative stress. Our bodies aren't exactly as well adapted to that. And what we see is that, to me, it's analogous to the skill sets and the muscles that we develop to run sprints versus marathons. And that's what, as everyone on the call knows, we've been in at this point, is it's a marathon. And so what we're looking at instead of arousal is we're really looking at stamina and endurance, and how we cultivate the right energy to be able to endure and persevere through this long haul is really the challenge, and what we have seen help explain some of the different emotions and responses in the healthcare professionals that I work with in this fall-winter phase compared to the spring and summer phase.
So now we're morphing into a more general discussion here about resilience. I think the emphasis in wellness has focused appropriately on looking at the strengths and weaknesses, the risks, and other ways in which individuals and systems particularly can play a very active role in the ability to continue to provide the excellent care that we're used to providing. But resilience is increasingly used in a variety of different ways, and it's important to think about the different contexts within which we like to use the term. So here, the ability to bounce back after encountering difficulty is one way it's commonly referred to. The American Psychiatric Association would say that the process of adapting well in the face of adversity, trauma, tragedy, threats, or even significant sources of stress, such as family and relationship problems, serious health problems, or workplace and financial stress is important. And that captures probably the scope better of the range of areas of stress that people are trying to cope with. And then if you look at systems, we talk about the capacity of a system or an enterprise to maintain its core purpose and integrity in the face of dramatically changed circumstances, which of course is exactly where we are also. And then finally, there is a renewed emphasis in trying to think of resiliency in more of a community sense, which is the broadest way, the individual's role in that. And here we identify and use the collective strengths of the individual and community to live life fully in the present moment and to thrive while managing activities of daily living. I would add parenthetically that we are also in a change of our mental health orientations, more trauma oriented with these new adverse childhood events that have come to the fore as exhibiting long-term and chronic problems for health and mental health. And I know that in the African American community, there's a talk about the weathering effect that it has on one's health overall.